They cut into the wrong side of a child's brain, then tried to cover it up. This is not a rumor or an urban legend. It's a documented tragedy that unfolded in a supposedly reputable medical institution. Imagine trusting an entire medical team with your child's fragile life, only to discover that their negligence destroyed everything you hoped for. If you think this can't happen to you, think again. Today's story will change the way you see modern healthcare forever. Stay with me, because by the end, you'll question whether the hospital corridors we trust may conceal dark secrets and unspeakable errors. Welcome to Evil Healthcare Errors, where we shine a light on the unspoken side of medicine. If you believe in transparency and patient safety, hit that subscribe button right now. Together, we'll expose the truth behind the shocking mistakes hospitals never want you to hear about. It's 2004 in Little Rock, Arkansas. Meet Cody Metheny, a 15-year-old boy, full of potential but living with a severe brain lesion causing debilitating seizures. For Cody and his family, everyday life is a struggle. Medical appointments, missed school days, and the anxiety of another sudden seizure lurking around the corner. The doctors present surgery as the solution, the big fix that could grant Cody a chance at a normal teenage life. His parents, clinging to hope, place their trust in the surgical team at a well-regarded local hospital. This isn't a shot in the dark. The hospital is known for its skilled professionals. To reinforce their confidence, the hospital even invites a reporter to observe and document the procedure, showcasing their supposed expertise and transparency. Before we go any further, let me ask you, have you or someone you love ever faced a difficult medical decision, unsure whom to trust? Drop a comment below. Your experiences matter, and sharing them can help others feel less alone. Surgery day arrives. Cody, under anesthesia, cannot defend himself and cannot question what's happening. In modern surgical practice, there's a critical safety protocol called the timeout. This is a moment where the entire surgical team confirms crucial details: the patient's identity, the procedure planned, and the exact surgical site. It's a forced pause, a safety net against fatal mix-ups. But on that fateful day, the surgical team skips the timeout. Perhaps they're overconfident. Maybe they're rushing. We may never know the exact reason. What we do know is that this small step, often viewed as a formality, was the difference between a successful operation and a devastating catastrophe. Without the timeout, the surgeon begins operating on the wrong side of Cody's brain, the left side instead of the right. Healthy brain tissue is removed, forever altering Cody's future, and no one notices until far too late. For context, the concept of a timeout isn't just a suggestion. It's a global standard recommended by the World Health Organization, WHO, and enforced by many hospital accreditation bodies. Its sole purpose is to prevent wrong site, wrong patient, wrong procedure errors. Skipping it isn't a small oversight. It's a willful deviation from a protocol designed to protect patients from exactly this kind of harm. As the surgery continues, the medical team realizes their catastrophic mistake. Instead of immediately halting the procedure, coming clean, and doing everything possible to mitigate the harm, they make a chilling decision. The invited reporter is quietly asked to leave. No alarms raised, no transparency. They reposition Cody on the operating table and proceed on the correct side of his brain, trying to salvage what they can. When the surgery ends, the family is informed that there was a minor error, but assured that no real harm was done. Cody's parents, overwhelmed and exhausted, trust these words. After all, why would a surgeon lie? For 15 months, the Metheny family remains in the dark. They live each day believing that the surgery was at least partially successful, and that Cody's ongoing challenges are part of a difficult but expected recovery. If you find this cover-up as disturbing as I do, please hit the like button. It helps us spread awareness of these stories, making it harder for such acts to remain hidden. Then comes the bombshell. Over a year later, an unrelated MRI reveals the horrifying truth. Both sides of Cody's brain have been operated on. The damage is extensive and irreversible. Cody, already a special education student, now faces a future needing 24/7 care in a rehabilitation center. His parents, who once harbored dreams of a healthier life for their son, are forced to confront a grim reality. Cody's life wasn't just changed by his condition, it was shattered by the very hands sworn to heal him. Think about what that must feel like. As a parent, You place your trust, your child's future into a surgeon's hands, only to discover that a moment of negligence and dishonesty has robbed your child of the life they deserved. Metheny family takes legal action, suing the hospital. Court documents expose the negligence, the skip protocol, and the desperate attempt to minimize what happened. Initially, a jury awards $20 million to the family, though this is later reduced to $11 million. The surgeon personally settles for an additional $1 million. Sometime after, the Arkansas State Claims Commission grants another $2 million, citing overwhelming evidence of negligence at the University of Arkansas for Medical Sciences, UAMS. Yet UAMS fights back, disputing the commission's findings and hinting at appeals. Silence and deflection become their tools. Instead of open acknowledgement, they retreat behind legal arguments. Meanwhile, Cody remains in a rehabilitation center, a living testament to the catastrophic failure of these professionals and the system that enabled them. Stories like Cody's are unfortunately not isolated incidents. While most medical professionals are dedicated, hardworking, and deeply caring, systemic pressures, overbooked schedules, understaffed operating rooms, hierarchical cultures that discourage speaking up, create an environment ripe for errors. When mistakes happen, fear of lawsuits, damaged reputations, and professional fallout may tempt individuals to hide the truth rather than uphold their oath. This is not how healthcare should work. Transparency, humility, and a willingness to learn from errors are key to preventing tragedies like this. Protocols like the surgical timeout exist because mistakes are human. Refusing to follow them is inexcusable. Do you think hospitals should face criminal liability, not just civil penalties for such gross negligence? Comment below. Your voice matters. One might hope that Cody's case would spark internal reforms, strict adherence to safety checklists, and a renewed commitment to honesty with patients and families. Yet the hospital's persistent reluctance to accept responsibility publicly suggests otherwise. How many other errors remain hidden behind closed doors, never to face the light of day? The medical community has made strides in patient safety, implementing surgical safety checklists and simulation training. But until institutions place patient welfare above all else, and until they acknowledge errors openly, real change will be slow. We must remember, behind every statistic is a human life, a family, and a future forever altered. As viewers, we must question, if this can happen in a respected hospital, what's preventing it from happening at yours? Educate yourself about hospital safety protocols. Don't be afraid to ask questions, request timeouts, and demand transparent communication from your medical providers. Patients have rights, and one of them is the right to know exactly what's happening in the operating room. Cody's story is a call to action. We must push for medical accountability, support legislative reforms that protect patients, and encourage whistleblowers within the healthcare industry to speak up. When the public demands higher standards, hospitals and clinics are forced to listen. If Cody's story moved you, if it angered you, if it made you realize that the healthcare system must do better, don't let this story fade into the background. Hit the like button to signal that these truths must be heard. Subscribe to Evil Healthcare Errors for more stories that force us to confront uncomfortable realities. Share this video with friends and family to spread awareness. The more people know, the harder it is for these errors to remain hidden. Comment below. Should stricter protocols or criminal charges be the standard response to such severe malpractice? Cody deserved a chance at a better life. He deserved honesty from those entrusted with his care. We can't rewrite his story, but we can learn from it. Together, let's demand a healthcare system where lives aren't gambled away by negligence, and where no family ever has to ask, "You took my brain and tried to hide it." Subscribe now for more in-depth looks into evil healthcare errors and the urgent need for accountability in medicine. Don't miss our next video. Together, we can shine a spotlight on the darkest corners of healthcare and fight for a safer future for everyone.